Ed Paget here. Today I want to talk to you about osteopathic treatment for back pain. Not many people know this, but osteopathy actually started before chiropractic and before physical therapy or physiotherapy. It started in the US in Missouri by a doctor called Andrew Taylor Still. And he reasoned that if the structure of the body was deformed in any way, twisted or out of alignment, that then the function of the body would be affected. So he reasoned that structure and function work together. And so with that in mind, the techniques from chiropractic, where they manipulate the spine, was similar to how the osteopaths would do it. And then when physical therapy or physiotherapy got developed later on, they again would use similar techniques to the osteopaths and the chiropractors. And these techniques were actually then used by still are used by modern orthopedic surgeons. So this kind of lineage from osteopathy to the present day orthopedic surgeons comes from this time back in the Missouri in the 1870s. Now, the original osteopath, A.T. Still, he reasoned that this whole body is a functional unit, that any change in one area could affect another area in the body. And that kind of makes sense, right? We have problems nowadays where you hurt a toe or an ankle, and you can see how that would change the way you walk, and you end up getting a sore hip or a sore knee elsewhere in the body. So one thing affects the other. Or we can think of the physiology of the body. If we have a problem with our pancreas, so diabetes, for example, then that can lead to problems such as numbness in the foot or ulcers and eye problems and so on. So you can see the body is this huge interrelated being. But the question is, how do we as osteopaths look at back pain? Now, it's very easy to zero in and just look at the back, and that's what MRIs, X-rays, and most surgeons want to do. They want to look at the back and say, well, this is causing the problem and this is what we're going to do about it. We're going to operate on it. So let's say you have an MRI and it comes back that you have a bulging disc. Now, a surgeon may be able to operate on that. Or even if it's a herniated disc, which means it's just gone beyond the disc bulge and now it's pushing out on one of the nerves. But they're not asking the question of why did it herniate in the first place? Why was that disc put under so much pressure that it decided to push out and bulge in that one area? Now, one of the reasons that things can be overworked in the lower back is tight hips. If the hips aren't working as well as they can be, that movement will be shunted or move up into the lower back. Now, conversely, if the upper back isn't moving as well as it could, that movement then can get shunted down into the lower back as well. And what is one of our most common postures nowadays? Sitting, right? So we tighten up our hips and we tighten up our back. And we wonder why 80% of us suffer from back pain at some point in our lives. So as an osteopath, we're going to look at the whole body. So the first thing I'm going to look at is, how do the ankles and feet work? Do they roll out the same both sides? Do they roll in the same both sides? Can you go up on your tiptoes the same? Can you bend your knees the same? Now, if there's a difference, let's say my left knee here goes quite far, but my right knee doesn't, you end up getting a twist in the pelvis. Now you can see that, right? So let's say I'm a keen CrossFitter, or I'm into weightlifting in the gym. I've got the bar on my back. Actually, I'm going to get a bar here. I've got the bar on my back and I want to line that up with the wall in front of me, like where you are right now. And I squat down, but one knee doesn't go as far. And so I twist, but I see that the bar isn't in a straight line. So I'm going to move that bar like this. Now let's do that from the side angle. One knee doesn't bend as much as the other because of the ankle. The bar becomes out of alignment. I pull this forward. Now I've got a massive twist in my lower back. Back pain. So you can see how a tight ankle in that situation would be the cause of your back pain. So treating the back pain or treating the ankle, like which one do you do? Well, we can use techniques to relax the muscles of the lower back, which will get tight. We can use techniques to flush out inflammation in the back. But we really need to get down to that ankle to treat that, so the lower back can move freely if that person squats or take a step or even sits down on a chair, so they don't get that twist into their back. So that's looking at the ankles. Next, we're going to look at the knees. can the knees extend properly, or is one knee habitually flexed? Because if one knee is habitually flexed, it's actually going to cause a drop on the pelvis on one side and compress one side of the lower back and open up one side of the lower back, leading to potentially disc bulges on the open side. So we want to see how the knees work. We also want to see how they flex. We want to look next, we want to look up at the hips. How do the hips work? Can they move left and right the same? Is the outside of the hip tight, which it commonly is in people who sit a lot? Then we want to see, how do the hips move from the inside? Is the groin tight on one side? And this muscle, one of these muscles in here, is called the adductor magnus, and I talk about this in my foam rolling. This little thing, not only does it pull the leg in like this, if the leg is up like this, is flexed, it acts as an extensor, it will pull the leg backwards. If the leg is extended, it will pull the leg forwards, and it can also rotate the leg. So it's involved in lots of movements of the hip joint, which then means if it's tight, it will really affect that hip joint and ultimately the lower back. We're also going to look at the hips to see if they can move in rotation. Do they rotate equally both ways? Do they rotate into external rotation, or do they rotate into internal rotation both ways? And if there's a difference between the two sides, is that enough to affect the lower back? Next, we want to look at extension. Can the hip extend? Because this is one of the muscles that gets very tight. It's called the psoas. Now the psoas goes from the thigh bone here, the femur, up over the pelvis and attaches onto the spine. And when we sit, again, this gets very, very tight. So a tight psoas can be the cause of a lot of lower back pain, because we've tightened it up, and so our body thinks this is the normal position here, we're bent. So when we stand up, how do we actually accommodate a tight psoas? Well, we stick our butts out. Now, if that doesn't work for us, we sometimes stick our pelvis forwards. Both ways are going to be irritating the lower back. Moving up the body, we want to look at the thoracic spine. Does it rotate both ways the same? Does it side bend both ways the same? Does it flex and extend as much as it can do? Commonly, this upper back gets tight from computer work, from our sort of forward-centric world that we live in. Next, we want to look at the shoulders. Do they move the same? Do we have flexion the same? Do we have abduction the same both sides? Is their rotation the same? Have I got a problem in my elbow or wrist, which means that I move one shoulder differently when I'm using my hand to the other, which causes an asymmetrical loading into the upper back, which then will cause asymmetrical loading into the lower back. Moving up into the neck, we want to see whether or not the neck rotates both ways the same. Does it extend and flex with good range of motion? Does it side bend with good range of motion? You know, up here in the neck is a hugely sensitive area at the top vertebrae, the C1 vertebra. And it can be responsible for different balance mechanisms within the body, as well as the ears. But if that C1 interface with the skull is not moving as well as it can do, it can cause all sorts of problems down within the body. And that's where things like neck adjustments can actually really help lower back pain. Okay, so that's a quick scan of the joints of the body without actually even looking at the lower back yet. But what else is there that an osteopath would look at? Well, if you have scars on your body, those things can actually tighten up the fascia. Now, the fascia is something that surrounds the muscles underneath the skin, and it's contiguous, which means it's related throughout the whole body. So a fascial scarring somewhere can actually cause a pulling. So commonly, abdominal scars can actually cause back pain. So I've seen an 80-year-old patient who had a huge appendix scar. And when that appendix scar, he was bent over it to protect it, and that was his habitual posture for God knows how long. In fact, he actually had the surgery when he was in his teens. So he came in with back and hip pain. We worked that scar, that opened up and helped his back and hip pain. And so his body was very strong and compensated for his whole life without giving him pain until he reached his 80th year. Also, we can have abdominal complications like IBS, like that's irritable bowel syndrome, where the abdomen gets bloated and then gets constipated. It's a cycle of diarrhea and constipation. That continual pushing out on the abdomen can actually affect the way the abdominal wall works. because our body doesn't want to push in with tight abs when there's a problem in the guts. And so it switches off or slightly inhibits the abdominals, which then means the spine has to work a little bit more by itself because it hasn't got the support of the abdominal corset. So we want to look at things like IBS, food intolerance, to see whether or not they are going to be affecting the lower back. Now lastly, and there's many more things, but just in this video, lastly, we want to talk about the diaphragm and the pelvic floor. So the diaphragm sits in where the ribs stick out the front here, and the pelvic floor is in between the pubic bones, your sit bones at the back. Now when you breathe in, that diaphragm should move down and that pelvic floor should contract slightly, otherwise things would fall out. But habitually, we tend, as Westerners, to use our accessory muscles of breathing up here. We breathe with our shoulders. This means the diaphragm does not descend and massage our internal context here. And it means the pelvic floor does not get its sort of co-contraction, which makes it remain strong. So we end up getting a weak diaphragm movement and a weaker pelvic floor. Now those two things support the back with this idea of this abdominal brace. So you have the abdominals on the side here, the obliques, rectus abdominis on the front, and then you have the back muscles, the QL either side here, the bottom and the top. That whole thing makes a cylinder. And if that cylinder can be nice and strong, you can see how that pressure in your abdomen will actually look after your lower back. But if any one of those areas isn't working as well as it can lead to lower back vulnerability, lower back use, and lower back overuse. So we'll be looking at the diaphragm, pelvic floor, and how the whole abdominal core works. So that gives you an idea of the osteopathic approach to back pain. Now, I want to put a caveat in here. Most manual therapists who understand the integrated nature of the body should be looking at this entirety when they're assessing back pain. So you will have chiropractors who do this, you will have massage therapists who do this, you will have physiotherapists who do this, but that isn't necessarily taught as part of their standard training. However, osteopaths are taught from the get-go to look at the whole body with every single complication when it comes to illness and injury. Look, if you like these videos, I really want you to subscribe and press like. Leave a comment below, and I do endeavor to answer every single comment if you have a question. All right, take care.